All right, today we're talking about something that could genuinely change medicine forever. Artificial intelligence. But, this isn't one of those simple tech is amazing stories. Nope, it's actually about a huge conflict. A technology with the power to save countless lives, but one that also brings some really serious new dangers to the table. We're basically looking at two very different futures being created at the exact same time.
And that brings everything down to one very personal question. A question you might have to answer a lot sooner than you think. It's not some far-off idea, it's this. Right now, today, would you really trust an algorithm with your life?
Because let's be clear, AI in medicine isn't just one thing. It's a technology that is simultaneously paving the way for two completely different outcomes, two possible futures. And this, right here, just lays it all out perfectly. On one side, you have the promise, right? An AI that can see something a human doctor might miss, literally saving someone's life. But on the other side, the peril. The very same piece of technology gets it wrong, misinterprets the data, and causes a total catastrophe. It really is the ultimate double-edged sword. So let's start with the good stuff, with that promise. Because honestly, it's nothing short of revolutionary. We're going to look at the incredible things AI is doing in healthcare, not in some sci-fi future, but like right now. This is where the big data and algorithms become incredibly human. I want you to meet Emily. For her, AI wasn't some abstract risk. It was a literal lifesaver. An algorithm caught her tumor way earlier than the usual scans would have, and that gave her the one thing that truly matters: more time. Her story is it's such a powerful example of what this tech can do. And then you see numbers like this, which show the kind of confidence AI can bring into the picture. A 92% success rate. I mean, that's an AI analyzing a situation and making a recommendation with a level of accuracy that can sometimes even beat a human specialist. That's the real power here, turning oceans of data into a single, clear number you can act on. And it's not just for one specific thing either. It's happening all across medicine. From predicting who's at risk for a heart attack with amazing accuracy to actually guiding a robot's hands during a delicate surgery. It's even being used for mental health, with chatbots offering support to people who might not have access otherwise. The potential here is just massive. But for every promise, there is a peril. We have to make a hard turn here, because the same systems built to save us can also go horribly wrong. So what happens when the code is biased? What happens when the machine is just plain wrong? Let's go back to Emily's story. Remember how an AI saved her life? Well, here's the twist. A different algorithm, one used by her insurance company, analyzed her case and flagged her as a future financial risk. And just like that, they denied her coverage. The very technology that gave her a future suddenly threatened to take it away.
So how on earth does that happen? Well, it all comes down to the data. See, an AI can look incredibly accurate, let's say 95% for the general population it was trained on. But what if that data didn't include enough people from certain groups, maybe based on their ethnicity or even just where they live? All of a sudden, the AI's accuracy for those people just tanks. It's not being evil, it's just reflecting the blind spots in the data we fed it.
And this problem has a name. It's called algorithmic bias. And it's not a one-off glitch. It's a systematic, repeatable error that ends up creating really unfair results. When the data we use to teach an AI is already biased, you can bet the AI is going to be biased too. It's a super simple but really dangerous equation. Biased data in means biased results out. Every time. And all of this makes one thing crystal clear. This isn't just a tech problem. At its core, it's a human problem. The whole challenge of AI in healthcare really comes down to the choices that we, as people, make. So let's try to understand this by looking through the eyes of four key people right in the middle of this debate.
Each one of these people is facing a massive dilemma, and there are no easy answers. If you're the patient, what do you do? Trust the cold, hard data from the AI, or go with your doctor's gut feeling? If you're the doctor, do you lean on the AI to be faster, or do you risk overriding it and being wrong? And for the data scientists building this stuff and the policymakers trying to regulate it, wow, the trade-offs between speed, safety, and fairness are just huge. So let's actually put you in the hot seat for a second. Imagine you're the data scientist. You've built an amazing algorithm, it works, but you know it's not perfect for everyone. What's your next move?
Okay, here are your two options. Option A, you release it now. The algorithm will start saving lives on day one, but you know for a fact that it will work less well for some people. Or option B, you wait. You delay the whole thing to go out and collect better, more inclusive data. But during that delay, all the people who could have been helped by the imperfect version get no help at all. There is no right answer here. Either path you choose has a real human cost.
And I think what this really shows us is that the future of AI in medicine isn't written in stone. It's not about what the technology is going to do, it's about what we choose to do with it. That promise and that peril, they're two sides of the very same coin, and we're the ones who have to decide which side lands face up.
What we're holding is an incredibly powerful tool. It's not good or bad on its own. It's just a mirror. It reflects our priorities, our ethics, our choices. If we leave it unchecked, it could absolutely make things worse and cause real harm. But if we can guide it with wisdom and care, it has the potential to help millions and millions of people. So that leaves us with one final and absolutely critical question. When it's a life or death decision, who gets the final say? Should it be you, the patient? Should it be the doctor with all their years of experience? Or should it be the machine with all its data, its potential, and all its flaws? The way we answer that is going to define the future of medicine.